Hi, everyone. I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening.
Hi, I'm Deb Flashenberg, and I'm your host of Yoga Birth Babies. And today we're going to talk about PCOS, Polycystic Ovarian Syndrome. So we're going to look at how PCOS impacts fertility and how PCOS impacts pregnancy. So if you're pregnant and you have this, I think you're going to get a lot of information about how to advocate for your best health and your best pregnancy. We also are going to look at examining the role of environmental impacts on the endocrine system and how it impacts PCOS and our hormones in general. I found this fascinating. And in fact, after this conversation, I went through a lot of the stuff I have in my house, from my beauty products to stuff we use for cleaning products, and I got rid of them because the more I dive into this, the more I realize how delicate our bodies are and how there's so many outside factors that can change that, especially when we're looking at PCOS. So to have this conversation, I have Dr. Aumatma Simmons, and I also have Doreen Bloch. Let me tell you a little bit about them. So Aumatma Simmons is a double board certified naturopathic endocrinologist and doctor in practice for over 15 years. She specializes in fertility and is the best-selling author of 2 books, Fertility Secrets, What Your Doctor Didn't Tell You About Baby Making, and Infertility, Struggles, Secrets, and Successes. Doreen Block is the founder of ELLEMENT, the first personalized prenatal supplement company. Doreen is a graduate of UC Berkeley and holds a nutrition science certification from Stanford Medicine. I really enjoyed this conversation. Even though it's a big topic, it's a lighthearted, easy way and very understandable conversation. I think you'll get a lot out of it. Before we jump into my conversation with Aumatma and Doreen, I just want to give you, as always, some studio updates. Wow, so things are still chugging along and really well. And I want to always thank the community for helping bolster PYC as we keep moving forward, heading towards our 22nd year. Wow, it's bonkers. So we still have all of our classes in the morning online. So we have 6 days a week of classes online and, of course, in studio as well. We have evening classes in studio. All of our workshops that are offered in studio also have a corresponding on-demand workshop, so you can check that out in our on-demand library. And then as we start to wind up our teacher trainings for this, what I think of a year as in a school year, because that's how my life works. So we're winding down our in-person teacher training. So this March and April will be our last of 4 in a row prenatal yoga teacher trainings. The first 3 were online, and this last one for March and April is in person in New York. So maybe you'll join me. And then we'll top off the year or finish off the school year in May with our online postnatal teacher training. So if you are passionate about supporting the pregnant person through a yoga practice, through childbirth education and community support, check out our website, prenatalyogacenter.com. If you are expectant or a new parent and you want to dive deeper into our classes, also check out our website. And then, as always, again, thanks for being part of our community. When or if you have a moment, I would so appreciate you taking the time to leave a rating and a review. It helps people find us. Okay, we're going to take a super quick break, and when we come back, please enjoy my conversation with Dr. Aumatma Simmons and Doreen Bloch. Hi, Doreen. Hi, Dr. Aumatma. How are you?
Doing well, thank you. How are you?
I'm doing great. I'm excited to talk about PCOS because honestly, I don't know much about it. And when I started researching this, it seems so much more prevalent than I realized. So because it's a topic I have no idea about, I'm just going to sit here and suck up information. So I'm so excited. But I guess before we jump into that, first of all, welcome to the podcast. But I would love to learn a little bit more about both of you. So whoever wants to jump in and start.
Sure, I can start. So I'm Dr. Aumatma. I am a naturopathic doctor by training with a board certification in naturopathic endocrinology, which is basically a fancy way of saying I really love hormones. And I've spent a lot of time diving deep into hormones and into mostly my specialty, which is fertility. And PCOS is definitely a big component of that. So yeah, spending a lot of time in that world. And what else about me? I have a 5-year-old. I became a mom later in life and had a relatively easeful experience thanks to all of the stuff that I was doing on myself to like test it out and just like, get my act together as much as I tell to my patients and clients to like, you have to do all these things. And they're like, do you do it? I'm like, actually, yes, I do. Thank you.
And that's how I guess supported you becoming a later or older. I was also
Yeah.
in what people would call a geriatric pregnancy.
Yeah,
I had my first, I
exactly.
hate that term, although now I kind of embrace it because I'm like, I'm a badass that way. So I had my first at 37 and my second at 40. And
Mm,
I was really proud of that. So
yeah.
I believe, supporting the older mom. Doreen, I'd love to learn a little bit more about you.
Yes, I'm so happy to be here with both of you. I met Dr. Aumatma several years ago when I was postpartum. I also have a 5-year-old, and I come into the conversation a bit unconventionally. Basically, I decided to embark on this journey with Element, which is the first ever personalized prenatal supplement solution when I realized through my own journey of becoming a mom that it felt like there were so many prenatal supplement options, and yet the foundations were sort of missing in terms of how every pregnancy is different, every fertility journey is different. Why are our prenatal supplements not tailored to each particular person? And so I connected with Dr. Aumatma around this idea several years ago, and we really clicked, I think. And it's been such an important part of the journey of bringing Element from a concept all the way to now, having amazing customers all around the world who are using Element to support their own journeys. So along the way, I got a nutrition certification from Stanford, and I live in the San Francisco Bay Area with my family. So that's a bit about me.
Wonderful. All right, let's jump into this topic because, again, I am just like an open book. I would love to learn, or maybe it's actually an empty book because I know nothing about it. So let's jump into what is PCOS?
Yeah. So PCOS it stands for Polycystic Ovarian Syndrome. The first thing to note about PCOS, it's not actually one thing, even though the name makes it sound like it is. So the name in and of itself is like polycystic ovaries, right? So essentially there can be these cysts that grow in or on the ovaries that are kind of one of the classical signs and symptoms of PCOS. But really, the way that I think about PCOS is like it is really a syndrome. So that's the only part that is actually true about its name. It's a syndrome. And traditionally there is the golden standard for the diagnosis, quote unquote, of PCOS, which you have to have 2 of the 3 following criteria: oligo and ovulation, which means either you ovulate off cycle, it's not regular, or it just doesn't happen in multiple cycles frequently. Hyperandrogenism, which is either like one of the signs and symptoms of that is either you have like chin hair or hair on the abdomen, hair where it shouldn't really be hairy, essentially. And then polycystic ovaries. So of those 3, you need to have 2 to get the official diagnosis. Unfortunately, there is what I call a big subpopulation of people that actually have some of the syndrome without the diagnosis. And that's where we can get into the nuances of it. But like PCOS is affecting a lot of people, and there are a lot of people that it's impacting that maybe don't have the classical signs and symptoms and hence never get worked up for it. So that tends to be a lot of what I see in my practice, because there's a lot of people that will come in and say, oh, I have unexplained infertility. And then we're doing their labs. And I'm like, no, it's not actually unexplained. You have this like milder form of PCOS where you don't have the overt symptoms, but there's a degree of anovulation. There's a degree of imbalance of hormones that is just throwing off your fertility.
Does it show up at a certain age more than others, or is it it can show up anytime?
It can honestly show up anytime. A lot of people were maybe not diagnosed with it, but early in their menstrual life. So at menarche or soon after menarche, they were put on medications to kind of quote unquote regulate their cycles. But the regulation of cycles really was kind of putting a Band-Aid over what was actually going on, which is the PCOS under the surface. So a lot of these women have had PCOS for a long time. We just didn't know it because they were on birth control. They're like, oh, my periods are always normal. Well, they're normal and regular only because you're on birth control, and the instant you get off of it, cycles go crazy.
And I just want to add that this is one of those topics that I feel like, back a decade ago, certainly I myself or my friends, I feel like we didn't hear a lot about it. But just to wrap some numbers, the CDC estimates that anywhere from 6 to 12% of women of reproductive age are affected by PCOS. So even though it may have been more taboo or something that people didn't hear about as often, it is something that is now being talked about more and more.
So that's a significant amount, 6-12%. So how it's be? So you talked about could be hair where, like on your belly or your chin, where oftentimes we don't see it. Missed menstrual cycles. Are there other symptoms? Like, would someone feel it in their body? Like, would they be achy or on their ovaries? Like, how would someone even know to check in with their care provider about this?
That's a little bit of the problem, is that sometimes there are no symptoms, right? And like if you have polycystic ovaries, for example, if that was your symptom, but no one did an ultrasound to see if you have polycystic ovaries, we probably just wouldn't know. We wouldn't know the difference because there are no like physical symptoms of that.
Okay, I'm wrapping my head around this. So should it then be regular screening or?
So the symptom, I was specific about the polycystic ovaries, but the other symptom that's often present, which is ignored, is the anovulation, the irregular menstrual cycles. Like the women with the really long cycles often are going to potentially be the ones that might have PCOS. And I'm pausing with the it's not enough to diagnose, but it's enough to be that little voice in the back of the head that needs to go off and say, hey, you need to just be worked up so that you can be sure if you have it or you don't. And if you do, it's okay. It's not the end of the world, but it's going to play a significant role in fertility if you have PCOS.
All right, so let's actually jump into that. My mind has so many questions, but let's head down this road first.
Yeah.
So if someone has it, I'm kind of putting it together in my head. It's going to impact fertility because if they're not having a cycle, it's hard to figure out when you're ovulating.
Yes, exactly. 1 in 2 women with PCOS actually struggle with fertility. So basically 50% of the women that have PCOS are going to have fertility issues.
And so then they might not even realize, though, that's what's going on. They're just thinking, I'm not getting pregnant. It's just bad luck.
Right. Yeah. And it's so nuanced and it gets so tricky when they're thinking about oh, I get my period every 30, let's say 32 days, just for the sake of like argument.
Mm-hmm.
If you get your period every 32 days, then somewhere at the halfway point would be when you're ovulating. So these women are walking around thinking they're ovulating because their cycles are regular, right? But if you've never checked an actual ovulation, you don't know. And what's the biggest way that women are checking for ovulation? LH strips. And unfortunately, in PCOS, LH strips aren't going to do it because hormonally, their LH is usually much higher than an average population. So it's always going to show positive for LH. It's a matter of fact, it would be overtly confusing because there is no LH surge. It's just like all the time LH is present and the strips just get confused and they're like, what's happening?
It's funny. I thought you were going to say how they check. This is just where clearly my brain goes. You're like, how do you check for ovulation? And my first thought is like the vaginal fluid, the mucus. Would that be the case for someone with PCOS?
So again, like the nuance of this is often women with PCOS are going to have higher amounts of cervical fluid. So it's not always like fertile cervical mucus, but they're going to have more of it. So it's going to be women that literally like end of cycle, there's no dry days. They just go right into cervical mucus. And then they have cervical mucus on and off for weeks. And they're like, well,
so they're very confused.
Was this fertile or not? Yeah.
Oh gosh, that doesn't. Okay, so I see how that impacts fertility. So say someone does get pregnant, they have PCOS. How does it impact pregnancy?
There are a lot of impacts to pregnancy. One of the biggest ones, and we didn't talk about it yet. So one of the things that I think is a big cofactor in PCOS is the metabolic impact. And often these women have insulin resistance, high blood sugar levels. Like there's the metabolic component of it is pretty large. When they get pregnant, they're now at higher risk for gestational diabetes, as well as higher risk for preeclampsia because of the cardiovascular effect of PCOS. So yes, we think of this as like a hormonal issue, but it's impacting so many things that are going to be more likely to show up in pregnancy, creating more problems essentially for the mom and the baby.
So if someone doesn't know they have PCOS, they may have had some fertility issues, but they got pregnant, but they don't realize they have that. And they may be at a higher risk of gestational diabetes and preeclampsia, especially preeclampsia is quite concerning. How would their care provider know to even be on the lookout for these things?
You need a really good provider, essentially.
Okay.
So, I'm sort of laughing because I had when I was pregnant, I got preeclampsia and it was like 2 or 3 weeks before my due date. So it wasn't like a long period of time that I had it, but every practitioner in that practice missed it. The only reason that they even thought to work me up was my adamantness around no, you need to work this up. And the OB was like, no, you're fine. Your blood pressure is 120/80. I'm like, check the records. For the entire pregnancy, my blood pressure has been 90 or 100/75, right? 60 even. I run so low on my blood pressure that they didn't realize that the 120/80 was hypertensive for me. So it's kind of funny because you just you have to have a practitioner that's just very aware of what's happening for you. Are they listening to you and not just going by the stats?
Right. Is it out of the norm for the individual?
Mm-hmm. Yeah. And then like, if you knew that you had PCOS, like some of our clients, we usually encourage them to do gestational diabetes testing early. We're putting in protocols in their preconception period so that they have lesser risk of any issues in pregnancy. So we have a pretty good track record, like women that are going through pregnancy, even with PCOS, like they don't have to get these things, right? They're somewhat preventable. They're somewhat in our power to influence, but knowing is the biggest factor. Like once you know, then you're like, okay, great. We can do something about it. A lot of PCOS women are like, oh my God, will I ever get pregnant? I'm like, the gift of PCOS is you will always get pregnant. You just need the right keys to do it, right? Like someone needs to know how to put all the pieces together for what's happening for you. And you need the right support nutritionally, but almost all of them get pregnant and have a healthy child.
Okay, so now my brain's going another direction. All right. Before I open this can of worms, we're going to take a super quick break. When we come back, let's talk about how if someone does have PCOS and they want to get pregnant, how do we stack the cards in their favor to support that fertility? That's a big question. Let's take a break and we'll come right back. All right, so now someone might be listening. We're back. Someone might be listening. They're like, okay, I have PCOS, or I think I do, and they're going to find out, and they do want to get pregnant. And we know it can impact fertility. What are some of the steps they can take to help that? Because I'm sure if they've been trying and their cycles are kind of unreadable to some of the more common indicators of fertility and ovulation, they're probably frustrated. So what are some of the steps they can take?
Yeah. So I'm gonna loop Doreen in a second here. But really, if they know that they have PCOS, our first question is what type of PCOS? And
I didn't know there are different kinds.
oh
Okay.
yeah. There's at least 4 different kinds, and there's still like debate about other ones. So we need to figure out like what is the underlying physiology that's causing your PCOS? Is it inflammation? Is it the hormones? Is it that your body is not responding or doesn't have a great connection between your insulin and blood sugar and your ovaries? And there's a connection there. Is it that you have hypothyroid and that's connected to your PCOS? And women with PCOS have higher chances of thyroid issues. So there are a lot of different things that can be happening under the surface that so often, like slapping a label on it doesn't actually help us figure out. So to me, that's the first step.
Okay.
And then based on what's going on, we get more in depth about what things are going to support the preconception phase, what things are going to need to be optimized in order to get them to that optimal fertile state. And then we can bring in supplements, herbs, all the things that are going to support that transformation and support their pregnancy.
Okay, now that makes a lot of sense. And then I'm assuming they want to get a care provider besides working with would they be working with an endocrinologist or a naturopath like you, or all the above, and then a care provider, either midwife or doc or OB that is familiar with this? Is that how you want to get the team together?
Yeah, exactly. Like I am a big proponent of them finding a naturopathic endocrinologist because PCOS like primarily is an endocrinology issue, but if that endocrinologist doesn't see all of the underlying stuff, which is what naturopaths are good for, if they don't see the underlying stuff, then they're likely to be given metformin, which is the most common treatment in the Western world, in the endocrinology world for PCOS. But like I said, metformin will address the insulin resistance blood sugar imbalance, all of those things, but it doesn't actually do anything for the ovaries. So now we're at a point of like, okay, well, we think it's sort of under control. Now you need to do Clomid. That's the secondary step. So we gave you metformin, you didn't get pregnant. Let's give you Clomid. That doesn't work. Let's put you into IVF.
All right, can you back? Because I know what Clomid is. My friend used it, but can you talk a little bit about what that is for people that are not sure?
Totally. Clomid or letrozole, I should say. So there's two options there. It's basically medications that stimulate ovulation to happen so that there can be potential for conception, right? So if you're anovulating, meaning you never release an egg, the eggs just kind of dissolve and turn into cysts, which is what is happening with the multiple cysts, then you don't ever release that follicle in order for conception to be possible. So basically the idea is let's give you a medication to cause that release. And once the egg is released, then theoretically the egg and sperm should meet and you can get pregnant.
Okay. All right. I'm wrapping my head all around this. So would these be the main, so these are the treatments that I'm guessing are kind of typically used. Is there other treatments that may not be kind of mainstream that you recommend for PCOS?
Absolutely. There's really good research actually on berberine. There are double-blind placebo-controlled studies comparing metformin to berberine, and berberine had better outcomes.
And what is berberine?
Pretty amazing. Berberine is an herb. It's an extract of an herb. There's a few different herbs that are high in berberine. But berberine is essentially a compound that is from plants that supports the kind of the insulin resistance blood sugar piece that we were talking about. And that tends to be a lot of the underlying physiology of PCOS. So addressing that is usually a good idea. There's a lot of good research on myo-inositol and D-chiroinositol in combination. There is research on N-acetylcysteine, which is essentially an amino acid. So there's good data on quite a few different nutrients and supplements that can support people that are trying to conceive with PCOS. I want to give a moment here. Doreen, do you want to chime in with some of the supplement pieces?
Yes, absolutely. So just to echo what Dr. Aumatma was sharing, lots of great research about inositol, which is why we include that as kind of a fertility booster for anyone who comes our way knowing that they have PCOS or if they suspect that they have it. And also, I want to highlight that there are some clinical studies that show effectiveness of omega-3 fatty acids for PCOS, as well as, and I don't know that this has been studied quite as in depth, but vitamin D also comes up in the conversation, something that, a lot of the US population is often deficient in. And so we definitely encourage supplementation with those two as well.
I love when we look at the whole person and the whole offering instead of just one way of rectifying an issue. So thank you for the nutritional point of view on that. So what are some of the strategies? So maybe somebody is listening and they want to get pregnant soon. They may not even know they have PCOS. Are there strategies for lowering the risks if someone has it or to actually avoid PCOS?
Well, so PCOS may be avoidable. And I say maybe, and I'm very hesitant about that because there is a component of it that it could be genetic, right? So if it's genetic, your mom may not even have known about it because it's, like as Doreen said earlier, like it hasn't been super common in our knowledge database until more recently. And people weren't getting worked up even for it, right? So there's a little bit of like gap of information, but there is a genetic component. So that part we can't do much about. There is a component of it that is epigenetic, which is essentially the layer of expression of these genes above our own genetic code. And that's something that is within our control. So the way that I like to think about it is we can optimize our genetic code by supporting the expression, the turning on and off of specific genes that are playing making some things respond poorly, some things respond better, etc. So if we can optimize that, then we're doing what we can to maybe prevent PCOS or lower the impact of PCOS on our reproductive organs.
So how would we do that?
Yeah, awesome. So let's get into it. I think of it, there's like 3 or 4 really solid things that literally anyone can do without harm. Number 1, I would say, is getting rid of the toxins. Toxins really screw with our epigenetic expression of our genome. So they turn things off that aren't supposed to be on. They'll like upregulate things that shouldn't be upregulated, right? So the toxins in our environment are playing a significant role in whether or not we are expressing what we should be and not under or over expressing, if that makes sense.
Mm-hmm.
So the toxins
is that one
is
reason?
the first
Can I ask,
piece.
so would that be one reason why it was just an article in the New York Times about this,
Mm-hmm.
why girls are starting puberty so much younger?
Yeah, exactly.
And this is why I had a conversation with my 9-year-old, almost 10-year-old, and she wants to use, and maybe I'm going too off topic, but as someone that understands the endocrine system, I bet you'd love this. So I watched some documentary series about the beauty industry and like fragrances and how it can affect estrogen. So this was maybe like 2 years ago. So I went through our bathroom with a big trash bag and I got rid of everything that had scents. And so every time my daughter, I was like a crazy person. And I'm like, we use jojoba oil to moisturize ourselves now. Get rid of that. So I was a crazy person. So I tried to explain to my daughter why she can't have certain lotions that have a really strong smell.
Yeah.
So these are the kind of toxins that we're talking about.
Yes, absolutely.
Okay.
Those are really big ones, are fragrances.
And another place to look as well, Dr. Aumatma and I spoke about this, in the early days of Element, is take a look at your supplements as well. Not to be the supplement nerd here, but, a lot of times people think that because it's something that you're taking, that you're ingesting, that there's, guardrails or regulations around it. Keep in mind, supplements are not an FDA regulated category. And there is often a lot of junk and a lot of toxins in supplements. And so it's just as important to be looking at what your supplements don't have as it is to look at what they do include. And some of the biggest offenders include titanium dioxide. It's actually been historically at times banned in the EU for being genotoxic, just as Dr. Aumatma was saying regarding gene expression. This is something that has been shown to potentially cause issues. So keep an eye out to avoid that one in your
oh my gosh, I'm going to have to right now after our conversation, so like I did for our bathroom and went through everything and got rid of everything that I thought was potentially harmful. I'm going to have to go downstairs. We have a lot of supplements and now I'm going to have to sit and read everything and look even closer. I thought I had, but I'm probably not the only one out there that hasn't thought to do so. Okay.
Yeah.
Wow.
Yeah.
Okay. This is stressful.
It can feel overwhelming and it can feel stressful very quickly. So toxins are kind of a thing to just keep focusing on, right? Like you don't have to go and change everything today, but like do a little bit at a time. There are toxins literally in every single area of our lives. Guaranteed. I don't care who you are. There are toxins in your house, in your environment, and like even in the air that we cannot control, right? So to a certain degree, like you can only do what you can do. And the way that I think about it is the ones that we're ingesting are going to be vital because we're putting them straight into our bodies. Next is going to be the ones that we put onto our skin. So like you went through the makeup and skincare and health and beauty aids, that's really important. The third layer is going to be what we wear or what we put on our bodies. And here we can go as deep as you like, but like yoga pants, for example, like all the plastic that we are putting on our bodies that is essentially like not supportive to our hormones. It's highly estrogenic, and that is throwing off our estrogen.
As a yoga teacher, that's sad because although the funny thing is I live for the days where I don't have to put my yoga pants on. I really get excited to wear jeans. But thank you for bringing that to my attention. That's upsetting.
Yeah. Well, there are companies that are eco and are like trying to do things differently. Right. So, I'm not affiliated with them, but there's a company called Pact, I think, that is like 100% cotton. Their clothes are cotton, right? So there are ways in which we can move towards removing the toxins where we choose to. And I say where we choose to because the yoga pants may not be so important if you're wearing them for an hour a day. Right. But
not my
if you
day.
live in them, right. If you live in them, then it may be worth exploring.
Right.
But our underwear certainly shouldn't be plastic. So that's important. Or I often pick on tampons and pads because I've seen like such a magical difference with stopping to use them. Tampons and pads are made with cotton. Cotton is one of the biggest like sprayed plant that there is. It's sprayed with glyphosate, which is basically Roundup. And glyphosate wreaks havoc on our microbiome. It kills all, like when it's sprayed onto our food and we ingest it, it's killing our gut microbiome. When we put it near our reproductive system, it's killing our vaginal and cervical and fallopian, like the entire reproductive microbiome. So it's going to impact our bodies in a significant way. And those are the things that I'm like, okay, what's the lowest hanging fruit for you? Like what's easy to change that's not going to overwhelm you, that's going to just be like a quick win, right? And often women with painful menstrual cycles, cramps, just like vaginal symptoms, things will magically disappear or get at least like 40 to 80% better just from stopping the use of pads and tampons.
Oh, that's so interesting.
Wow. I always learn so much. Can I jump in with a question, which is like, should I and others be looking for like an organic stamp on, some of those products? Like how can we be more confident that it's, maybe a more thoughtfully made product?
Yeah. So with pads and tampons, like organic is certainly better. I am a proponent because cotton is mostly grown in fields, and most of these fields are right next to each other, right? So you may have an organic cotton field right next to a non-organic cotton field. And most of the sprays are done top down, very low bar of control in those environments. So my perspective is like organic cotton. If I have to, sure. I have a couple of like organic pads laying around if I absolutely must. But my preference is always for like menstrual cups, which are like not cotton at all, right? They're latex, most of them. And they're like high quality, high grade, medical grade latex, which is a lot safer. And then we have organic cotton panties that are period panties, essentially, that are not only organic, but then you're not going to keep replacing them. So the more you wash fabric, the more you're like losing any possibility that the spray is still there, right? Like my organic cotton panties from 3 years ago have been washed so many times, like there's no remnants of toxins, potential toxins in there. So you're lowering that risk over time just by reusing the same ones.
I love this stuff because I love a practical kind of checklist, because I'm sure we have people out there that are concerned about this, especially if they're considering pregnancy. And some of these seem really attainable. I like what you said, like grabbing the ones that you can do that don't stress you out. And then I guess, kind of systematically and putting some thought into some of the other ones. So, ooh, this is exciting. Thank you.
I'll just say with PCOS, the other like big ROI that you're going to get is going to be the stuff that removes plastic from your life. So plastic containers, buying food in aluminum cans that are lined with plastic, even if they say BPA free, most BPA free products are actually going to use BPS or BPF, which is worse than the BPA to begin with.
Ugh.
So they're all bisphenol compounds. The BPA got unpopular or like kind of made it in the media. So now companies have gotten smart and they're like, oh, it's BPA free. They didn't tell you it's BPS free. They didn't tell you it's BPF free. It's just BPA free. So just like, to me, as much plastic as we can eliminate, right? Like not buying food in plastic, not putting food in plastic bags to store it. I've seen a lot of people like doing meal prep and it's all going in plastic bags. And I'm like,
oh my gosh, I tell my
God.
mom that all the time. I'm like, she's like, but it's microwave safe. I'm like, but you shouldn't be using it anyway. So
Right.
here's another question about the plastic. So we often will get stuff that's in plastic and then we'll take it out and store it in glass. Is that better? Or is it once it's in plastic? Okay, so that's better.
Absolutely.
Right.
Of course. It's anything that you are taking a step towards shifting is better, right? Like again, I feel like it's doing what you can. Start with where you're at, do a little bit this month, do a little bit next month, do a little bit the next month. So it's a journey rather than like, oh, I'm just going to like go and remove all the toxins. Like I can do that. And like the practical part of me in the back of my head is like, my husband's going to bring it right back in a week.
Yeah.
Right. So it's really like step by step by step. And like with my husband and I, he loves fragrance, right? Like he loves to smell good and he loves the smells and stuff. So I'm like, hey, I bought you an essential oil dispenser. Here you go. You know, like just trying to do what I can so that it's replacing the things that he's used to. Like, let's not burn these candles that A, have so many toxins going right into our air. And then B, the fragrances are also getting released when we burn this and the candles. So,
oh my gosh, you gave me so much to think about. It's funny. Like I literally started this conversation knowing, except what I researched in preparation for our conversation. And now I feel like I have a better grasp of it, but I still have two lingering questions about hormonal imbalances. So knowing the community that's listening, new and expectant parents, what is that hormonal imbalance? How is it going to impact breastfeeding? Because I have so many students that will say, it just wasn't working for me. I didn't produce enough. Could that be the hormonal imbalance of PCOS, or maybe also just toxin imbalance?
Yes. It's often, so if they have PCOS, yes. Really the potential of PCOS impacting breastfeeding is present. Like there is a risk. It does lower the production of breast milk. Some of the magic in addressing it is really figuring out if the production of estrogen or the metabolism of estrogen or the body's sensitivity to estrogen is out of whack. And if we can figure that out, then, and usually like we really need to do this preconception because a lot of the herbs can't be used in pregnancy. They can't be used postpartum. So really we got to straighten it out in advance. But if we have the time to straighten it out, then what we really find is that women's, like so many times estrogen is just looked at as the bad guy. But in PCOS, there's a really different dynamic that's happening. And that's from the conversion of testosterone to estrogen. And that conversion is often delayed or impeded by PCOS. So remember earlier I said hyperandrogenism is one of the things that has to do with PCOS, which is basically like too many androgens or testosterone compounds. So if that testosterone is staying as testosterone, it's not converting to estrogen, giving the support to get that conversion going is going to make a huge difference in these women that are not regulating their cycles, not regulating ovulation. Like so much of it depends on estrogen. So if we're not getting that estrogen surge that's needed for ovulation to happen or to signal LH, which then causes ovulation to happen, we're missing that key hormone. And that's the same hormone that is going to play a role in making the breast tissue be able to produce milk. So
this is so fascinating. So really what we're coming back to is that we need to look at the toxins in our environment and our role that we can play with that and what we're going to invite into our house or our bodies. And then with that understanding, before someone is planning pregnant, if they have that luxury, because sometimes it's not planned, that if they're wanting to really spend the time and investigation to their hormone levels to see, because it sounds like it just keeps, if you have PCOS, it can, as we talked about, play a role in getting pregnant, during pregnancy, and also breastfeeding. So a lot of time and focus while even now, like the person that's listening thinking, I might get pregnant, like we should start this immediately. Right?
yes.
Or am I just getting too much, like jumping into the Kool-Aid?
No, it's sooner the better. Like too often people are like, oh no, I wanted to be pregnant like 2 years ago. I'm like, yeah, well, why are you here now? Like what happened 2 years ago? So it's really like hearing something that makes sense and you're like, oh my God, this is me. How do I address it?
Yeah.
And
This is really snapping in my head. I'm really excited about this.
yeah. And just like being able to make that difference in the preconception period is huge because as much as we would love to support everyone, once you're pregnant or breastfeeding, it like a lot of the natural things just haven't been studied. It's not that they're harmful, but if we don't know that they're safe, then they're harmful.
Right.
If that makes sense, right?
Yeah.
Like we're not allowed to use it if we don't know that it's 100% safe. So that preconception period and like really addressing all of these things beforehand sets people up for the best possible success. It's not like we can't do anything if you're already pregnant, but we're going to have a lot more possibility of shifting things as if you reach out as soon as you realize that you need the support.
Oh, this is great. Okay. I'm going to start to wrap things up, but I do have one question for Doreen, since I know her focus is nutrition and supplements. So because I know Element does make it a personalized supplement, do you have a different, I don't know, formula or combination for folks that do have PCOS?
Yeah, so the way that we've built Element is that it's basically a modular design. What I mean by that is that we have, as opposed to like a one size fits all, which is how every other prenatal on the market is, like they just have their formula, right? That goes into a plastic in most cases, right? Speaking of plastic, a little plastic vial or plastic bottle. Element takes a different approach where we have many, many different formula types. So just as an example, we'll have, for B vitamins, we have many different formulations. Something that is beyond the scope of this conversation, but certainly I'm sure Dr. Aumatma and I would both love to have this conversation in the future around folate, for example. There's many different types of folate. And so with Element, we have different B vitamin formulations with different forms of folate. And so we allow our customers to really take a very, very personalized approach around, are they using B vitamin formula A, B, C, D, et cetera? And we're custom kitting not just for the B vitamins, but for every ingredient that's included. So fat solubles, there's different formulations for that, for your vitamin A, vitamin E, vitamin D, vitamin K1, K2, et cetera. There's different formulations for choline. There's amazing clinical evidence now that choline is one of those ingredients that should change over the course of your fertility journey. There's, for example, this new study that showed that women taking up to 900 milligrams daily of choline, that their babies had better cognitive outcomes if they were supplementing with that 900 milligrams in the third trimester. So we see people taking more, higher dosages of choline now in the third trimester. So much to unpack. But basically, the way that Element is designed is to truly provide that flexibility over the course of your fertility journey, over the course of your work with practitioners. So, for example, Dr. Aumatma or others, if they're telling one of their patients that they should be adjusting certain things, for example, maybe they discover they have thyroid dysfunction and shouldn't be taking iodine, no problem. Element can adjust around that immediately for our customers. So it's a really different approach, really innovative. It's patent pending. I always say I wouldn't have gotten into this if it wasn't something truly needed in the market. It's not about, just another prenatal brand. This is something that is really tailored to people who are looking to optimize their supplementation routine and make it as simple as possible for themselves, and have that extra support that they might not be getting from a traditional practitioner. Mm-hmm. So that's how we work. There's an amazing kind of easy, fun, like onboarding process. And then every month we're asking our customers for their feedback for what's maybe changed in their day-to-day lives so that we can customize every month's Element box according to that person.
Thank you. All right, we're going to take another break, but when we come back, what is one final tip or piece of advice you'd like to offer new and expectant parents? We'll be right back. We're back. All right. So each of you, if you can give one final tip or piece of advice you'd like to offer new and expectant parents, and you're both parents, so maybe it's coming more from, that parent hat. So who wants to go first?
I'm happy to jump in and then let Dr. Aumatma close out. So yes, I'm a mom already for several years, and we have another one on the way, which is we're super excited about. Thank you. And I feel like for my second pregnancy, one thing that I've been really reflecting a lot about is just trusting my instincts. I think that there are, even within this conversation, right, there's so many pieces of advice. And at the end of the day, it's all about your journey and just trust that you know what's best for you. I think that's something that has been really resonating for me.
I agree. Dr. Aumatma?
My favorite thing is if you're expecting to basically like load up your sleep bank. And it sounds so crazy, but like I wish someone would have told me like sleep deprivation was the hardest part of the first few months postpartum. And I went into it depleted because I was overworking and trying to figure out how is I going to like sustain my practice and like just all the questions, right? So bank sleep ahead of time, like get extra hours. It really will make a difference. And once you have the baby, figuring out with your partner, assuming you have a partner, if you don't, that's okay. You can get support. We have lots of solo moms by choice who have a whole community of people that show up for them. So it doesn't have to be your partner, but somebody needs to alternate with you so that each of you can get a minimum of like 6 hours of sleep every night. And we figured out like my husband could go to bed early because he was always an early sleeper anyway. So he was going to bed at like 7 or 8 and then would wake up at 4 and then he would be on duty. And then I was going to bed at my usual time and I would stay up till like 12 or 1, I think. And then that like, so we basically like staggered our sleep so that the baby was covered, feeding was covered, and like I was getting 6 hours of sleep. I was like, if I don't get a minimum of 6, I will literally kill someone. So he was like, nope, we got this. We can figure it out. And it was one of the best things that we did. And
that sounds great. Yeah, sleep is honestly my favorite things.
Yeah. And all of our friends were like, how are you so rested? How do you guys look so young? Like we're pulling our hair out. So yeah, this was the secret.
Where can people find your work?
The best place for us is Holistic Fertility Doctor on Instagram. So at Holistic Fertility Doctor, that is where I share tons of information, tons of like videos and content and all of the things that people might be into. I also have a podcast. It's called Egg Meets Sperm.
Oh, wonderful. I'll make sure we have the link to that. Doreen?
Egg Meets Sperm. It's the best name. I love it. So Element is at helloelement.com. Element is spelled with 2 L's, ELLEMENT, helloelement.com. And I also just want to share that, we have an amazing medical advisory board around this. So honored and grateful that Dr. Aumatma has been part of the journey from the earliest days. But if you have any questions for us about, how supplementation might be customized for you and for your specific case, you can also reach out to us at support@helloelement.com.
This has been so interesting. You've really enlightened me about so much about PCOS, as well as, again, going through my house and looking at what toxins can we get rid of immediately. So thank you for this conversation.
This has been an episode of Yoga, Birth, Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.
Hey guys, time to get in on the action for the biggest moments in basketball with Prize Picks, America's #1 fantasy sports app. Just select 2 or more players, pick more or less on their projections, place your entry, and win up to 100 times your money. Right now, Prize Picks will match your first deposit of up to $100. Just download the Prize Picks app and use the code GET100. That's code GET100 on Prize Picks for a first deposit match of up to $100. Prize Picks. Pick more. Pick less. It's that easy.